This is Lynn Fraser with the Killaby Center for Recovery. I'm here with Lorenzo Jones, and we're doing an interview about his work around addiction and recovery for the Radical Recovery Summit. So Lorenzo, if you want to go ahead and introduce yourself,
Yes.
and then we can get started.
Excellent. Hello, my name is Lorenzo Jones. I am the co-founder and co-executive director of the Catal Center for Health, Equity, and Justice. We started Catal roughly a year and a half ago. My co-director, Gabriel Saya, and I are longtime community organizers. Our co-founder and our director of strategy and campaigns, Melody Lee, is like a young, brilliant organizer and administrator. Catal's name comes from the process, right, of catalytic change, or that process, like we introducing like a catalyst, right, and then that change gets measured, right, and like in physics. So Catal, though, that change is the metric unit to measure that is a cato, much like a centimeter measures distance or inch measures distance. Mm-hmm. So we softened it to Catal. We feel like we bring a tremendous amount of experience to not just community organizing, but because of our organizing and policy and advocacy experience, we bring a tremendous amount of coaching and experience to new people coming into the field. We bring a lot of history around the field, almost like oral history even, that's pretty significant. To kind of help weave together relationships. So we kind of see Catal as being able to operate in the field across networks, helping people with intersectionality of issues. So you see in our name, health, equity, and justice. Right. That's an attempt to really try to frame up for people where some of these intersections are of the criminal justice and the healthcare system, for instance, and where some leverage points where programmatically as well as through advocacy and organizing, right, we can get some policy reform, systemic change, and program development that will help people deal with the consequences of these systemic problems that we're facing.
Well, and I know that you've had years of experience in community organizing. So how did you get from that, from your teen years, for instance, through to what you're doing now?
So, yeah, I mean, I started out as a community organizer in 1991, really as a leader and as a part of an organizing project. And from there, I moved into a pretty rigorous training process for community organizers. At that time, there was an attempt by some of the old, no, I shouldn't say old, some of the senior community organizing projects. Some of them, most of which had come out of Alinsky, and was this rigorous, on the ground, objective, pragmatic, right, community organizing primarily focused on building power and organization. So I learned my original organizing in the 90s is part of this Alinsky model, and not coincidentally, but I guess ironically enough, right, my early years of community organizing from 91 until 99, I was what we would call today a broken windows organizer. So funding for my work in the 90s primarily came from the Clinton crime bill. Mm-hmm. So, right? And so as an organizer, as a community activist, as a leader, right, as a young Black person trying to do something positive in my community, you got involved in community work. And community work meant you did things to better the community, right? So this is only one side of the story, right? So this is trying to find a path out of, you know, like, just like the situation that like I was in, like personally, right? Being a young Black male of the 90s, right?
Mm-hmm.
And so the other side of the story of the 80s and 90s, the other side of the story, and being a young Black male at that time, being a part of a young Black family at that time,
Mm-hmm.
with other Black males and Black people in it, right? Also a part of this specific, what we now refer to as the crack cocaine, you know, era or epidemic,
Right.
right? So I start out doing my organizing, and we'll come back to that. But you know, like I pretty much started. I come from a family, right, with two brothers and a sister, right. My sister is deceased now. Long time, and not only her, but like in the family, right, all of us, right, at varying degrees, right, long time experience as children. My mother never, and like I never seen my mother use drugs or like she didn't even smoke cigarettes.
Mm-hmm.
I shouldn't say even. She didn't just, but she didn't participate in that stuff.
Right.
But you know, we all as children, as siblings, kind of came up through that time, right?
Right.
With my sister's story, you know, probably being the most significant, being that we've lost her. We lost her a couple of years ago, and we lost her second daughter, my niece, in, you know, right around like, you know, right in the middle, like is like an actual casualty of the Clinton crime bill, right? And
Mm-hmm.
so in addition to like learning to kind of be an organizer, and for all intents and purposes, like as a young leader, community leader, as a young community organizer, working at a position, a job that was consistent with what I was being told was about being a responsible, right, young Black male, right?
Mm-hmm.
I was working and promoting the policies that we now look back on, and like literally contributed to like the death of my niece and sister.
Can you go a little bit more into that and explain what you mean?
So we as a family, like we're kind of coming up, and we've got like all of our story as a family, right?
Yeah.
You know how that stuff goes. Like some of that stuff we haven't worked out as a family yet, so we don't even talk about publicly, right?
Right. Yeah, I know about that.
Right?
Yeah.
And so it's like, not like, and so we, my sister, like mental health issues, right?
Yeah. Mm-hmm.
And leads to like as juveniles, as children, right? My sister has some pretty like really sharp, like really difficult mental health issues, right? It's just to a greater degree, right? As a result of that, like she's like institutionalized, right? From the and not institutionalized in like, for instance, a necessarily a mental health facility, but institutionalized what we would learn were called juvenile detention centers. We used to call them bad kids homes back then. Right, where Black kids went, and they stayed there, and they would run away from those homes, and then these like case managers had to chase them down, and it was this one floor in the YMCA or the YMCA or YWCA where like all the bad kids went, these crisis units. And so
Right.
you can imagine this is like 89, 90, 91, 92, 93. By the time my sister is, but she goes into a variety of like juvenile mental health facilities, from Klingberg Family Centers in New Britain, Connecticut, to Gray Lodge in Hartford, the ABC Crisis Unit with, you know, medical inside of St. Francis Hospital, Institute of Living. So she just starts the rounds. But what's happening at the same time, this is, you know, 89, 88, 89, 90. What's happening at the same time is that Just Say No just rolled out and was established. and the original drug-free school zone policy. And I shouldn't say original, but like some of the first concrete drug-free school zone policies came out. And
Mm-hmm.
as we watched this kind of unfold on the screen, not really understanding the consequences on our family, this is still the late 80s,
Right.
right? We later learned that a state like Connecticut was changing their access to drug treatment to be consistent with the drug war coming down the pike from Washington, D.C.
And we know
So,
how that's turned out.
so here's what happens, right? So the feds change and write up drug-free school zones,
Mm-hmm.
right? In 85, I think it is, right? The next year, I think it's 86, Connecticut passes its own version of that federal policy.
Mm-hmm.
This is well before Weed and Seed. This is well before the National Crime Prevention Council, right? McGruff the crime dog, Officer Friendly. But this is where all that comes from, okay?
Okay. Mm-hmm.
So let me back up, right? So my family, we hit this age where we all become like these young teenagers, right? And kind of like transitioning into adulthood. All of us have varying problems, right? With like how we're doing that and managing that, the way families do, right?
Yeah.
And
Mm-hmm.
on top of that is this significant mental health issue that, at least in this case, right? There are other versions of this in my family, right? In this case with my sister. And I'm focusing on that story because we eventually end up losing my niece and my sister, right, to AIDS. Well, my sister doesn't die from AIDS. She dies from, that's a long story, right? We still haven't figured that out yet, right?
Oh,
But
okay.
my niece dies from full-blown AIDS. So, right, I want to say in 94. I shouldn't say she died of full-blown AIDS. She dies with AIDS, right?
Okay.
With really having received treatment for like a few months of her life. So,
Right. And the really effective treatments didn't really kick in until the 94, 95 in there. Yeah.
that's right? So we were like crack babies having babies,
Yeah.
these crack babies. We were like we weren't even into welfare queens yet. Like Clinton was just floating that super predators, all this stuff. And because the Clinton crime bill of 93, 94, right, that Clinton crime bill set up where they created a criminal justice system to receive all of these people that they were about to move off of welfare.
Wow.
So the contract with America, that's Newt Gingrich's like welfare reform, right? Clinton fronts it, right, later, right? But what ends up, I'm explaining all this to say, when we were telling my sister to go get into a program, we were being told, okay, by George Bush, like George H. Bush. We were being told by Clinton. We were being told by like even all the Democrats and social workers, everybody, that there were programs. But we don't find out until later on is that there were no inpatient programs for crack cocaine use and for like things and for drug addiction, cocaine addiction, right? And that meant, what it meant to our family was that we would tell my sister to go get into treatment, go get into a program. We hear about all these programs, right?
Mm-hmm.
She would go and she'd come and say, there's no program. We're like, you're lying, because that's what crackheads do. That's what sex workers do.
Yeah.
Right? And now it's like what we didn't know is that because my sister would have had a drug felony at that time, that based on Connecticut's policy, state laws, she wasn't eligible for programs because, right, she had this drug felony or she was charged with a law that was a mandatory minimum. So the Clinton crime bill creates all these, expands on and creates 3 strikes and you're out, right? Drug-free school zones, cracker powder cocaine disparities, all these things that get created. Every one of these mandatory minimums, once you get charged with them in Connecticut, you are not eligible for treatment versus incarceration.
That is insane.
So my sister would come home, other people like her would come home to their families and say, I am trying to get into a program, but there is no program. And people would say, you're lying because we just saw a commercial.
Right.
We just got a brochure from the Urban League. Our pastor just told us about a program. And we were not being told that, one, she was not eligible because of the criminal justice policies, but also she had to have she had to be suicidal to actually get a room, to get a bed.
Right.
Other than that, to get treatment, you had to go into prison. So welfare reform moves all these folks out of the safety net, right? Dismantles that completely,
Yes.
turns social workers and case managers into agents of the drug war, right? No men in the house if you get assistance, no welfare to work, right? All that. And so your case manager, your social worker, people trained as social workers were forced to operate as these agents of the drug war, right? Because the only place they could get services for a family who needed them was through the drug war.
What a tragic impact on your family.
Fast forward, when President Obama does the Affordable Care Act and Affordable Care and Patient Protection Act 2010, when that happens, they literally state, and I know Connecticut specifically, were throwing people out of jail, out of prisons, because those beds were being paid for with money from what would have been the public health system. Okay. Because that's how they paid for prison beds was, right? So then we would get the statistic that says, oh, whatever the number is, don't quote me on the number, but like 89 or 95% or whatever of like prison inmates have mental health issues.
Right.
Yeah, because for the last 20, 30 years, the only place you could get mental health services if you were poor and had state or general assistance was through the prison system, until the Affordable Care Act comes and you can't pay for those prison beds anymore with public health dollars.
Oh, okay. Wow.
That's amazing. So when you look at places now doing programs where they're doing front end diversion around for active drug users and things like that, all of a sudden you start to see where like expanded Medicaid is being used by some places, right, to provide services, right? I'm kind of jumping around here, but we went back to like the mid-90s.
Right.
Go ahead.
Do you feel like someone needing treatment now has a chance of getting good treatment?
Oh.
Is it pretty dismal?
I don't know. And I'll be honest with you, I'll give you an answer to that question with this caveat, right? Like we believe people closest to the problem are closest to the solution, right? And so because I'm not somebody in the process of seeking treatment, right? I just want to give that caveat on the front end. I will say this with that, just with that in the front is like, I want to err on the side of caution and say no. And only because there may be opportunities for some people to get treatment that they need and access that treatment. That's always been the case. It's always been some people who could get it, even some poor people. I would err on the side of caution and say no, only because we know that whatever is happening isn't adequate. Right. Even though I'm sure there's some cases where there's somebody in some place or some project somewhere doing it well, because it's not available to everybody equally, right? Then no.
Not really a system-wide change.
That's right.
One of the things that it's really clear talking to the people I've been talking to for the summit, but also just generally researching the whole area of addiction and recovery, is that trauma is at the root of addiction, and that a mental health approach is much more helpful and humane than a criminalizing war on drugs kind of approach.
hmm Yeah.
How is it that, how is it, I'd be interested to know more about what your organization's doing, and I know that you're working around the criminal justice system as well. What are you doing there in terms of addiction and recovery, and the incarceration of so much of the Black population in particular?
Yeah, I mean, this is two pieces that we would see this in like not only two, but two primary fronts, right? And
Hmm.
we base it on one is a principle and one is a rule, an iron rule.
Okay.
So in community organizing, there's an iron rule. We don't do for people what they can do for themselves,
Right.
right? And in harm reduction, right, we adhere to the core principle of harm reduction. We meet people where they are.
Hmm.
So those two things kind of provide us like some goalposts to operate between, right? If we're outside those two things, we're not doing what we're supposed to be doing as a
Right.
general rule. So yes, like we're doing work now specifically around closing Rikers jail, right?
Hmm.
Um, that includes like what the plan would entail for people coming home, right? Like the actual plan for like the jail is closed, what happens to the people, right? What happens, right? How is public safety, maintained? Like, so it's a very comprehensive conversation. Our job in that space is to make sure that people who have been directly impacted by the problems created by Rikers, right, are at the table and participating in like those negotiations, demanding like the reforms and changes they want. So like that's our community organizing side,
Hmm.
right? So it's about people, it's about relationships, building people power.
Who
We
gets to speak?
hmm?
Who gets to speak?
That's right, right? People
Yeah.
representing themselves. We've based that in our harm reduction work, right? That's right. So this is all about using like putting public safety and public health together. I mean, like public health together and let me get it right. Putting community organizing and public health together to create public safety and maintain public safety. So
Mm.
relationships with each other, as well as like the creation of programs that are consistent with what those people in relationship with each other want. So we come at it from both sides. We want to organize people who are directly impacted, whether that be rich, poor, urban, rural, suburban. If you're impacted by a problem as it pertains to public health, as it pertains to justice and equity, we want to be able to organize you in relationship with each other to make the demands on the programs and systemic changes that you want, right? Based on what you want yourself, right? Your self-interest for all intents and purposes.
Right.
That's a very unique thing. It's a very unique thing because we do not see people, in this case, for instance, active drug users, people who are self-medicating, sex workers, people who like are what we would classify, but not classify, what we would recognize as people who would be the core of like a harm reduction community. So that includes people who aren't users, medical professionals, that includes like allied social service providers, right? We would organize those folks in a relationship. And one of the ways we've done that is through what we call the LEAD program, the
Hmm.
law enforcement assisted diversion, right? Where we're in Albany, New York, and in Connecticut. We'll be looking at projects in Connecticut where we're like helping municipalities learn and implement front end diversion for people with mental health and drug use issues, right? That they're dealing with.
Hmm.
Um, we go ahead.
Oh, I was just going to ask if you could give us an example of what would that look like for someone coming into a community that had that program in place, the LEAD program in place.
Yeah, so right. This is what makes this different from treatment versus incarceration, right? Is that LEAD operates with the premise that incarceration is not it's like literally the last result. It's not even an option necessarily. It's a last resort, right?
Yeah.
And so this is front end, at worst, it's front end diversion, right? Because it involves the police department, it involves law enforcement, but it involves them because that person is being engaged because, at least according to the law today, they broke the law, right? So that calls for like whatever the systemic response is. It calls for the appropriate systemic response. I mean, the systemic response, even if we don't think it's appropriate, right?
Mm-hmm.
And so because they broke the law, and that's what that is. So once we kind of deal with that hurdle, it's a big one, right?
Yeah.
The goal becomes like making sure that we actually include police and law enforcement.
Right.
That includes the DA, right? That includes the public defender's office. That we include them in what we would call front end diversion of someone who otherwise, if we didn't do this, would like just kind of hit the system and get swept up in it.
Right.
So a person would be encountered by, right, law enforcement, right? And law enforcement would then, right at that moment, connect that person to, right, services that they may need, right?
So instead of sending them to jail.
No, and instead of that, and that gets determined, right, by the police officer, because they've got to really check off a number of things to get to a place where this person, right, can like receive a referral, not even a summons, a referral to what would be called the LEAD program, right? LEAD Life program.
Yeah.
So the relationship between the case managers and the police, right? That a high premium is put on that just for the systemic, right? Intersectionality, right, and their relationship. A high premium is put on like the lead participant, right? It's really clear to everybody that the person that this has to not only work for, but for sustainability of the program, politically, right, it has to work for is the participant and then ultimately the participant's network. So that would include their family, their community, their social network, their professional network, right?
Mm-hmm.
And that has had mixed, that stuff is mixed. So some people are like, that stuff is horrible. Some people are like, that stuff is great. Some people are still working on it and turning it in different ways. So you get LEAD and you get LEAD-like programs. But LEAD would be an example of some attempts to like bend the system here, right? To like strenuously coerce it, right?
Right.
Right. Some political leverage that we developed by organizing people in relationship with each other to make demands on those municipalities, right? To bring a program to them that can be bent and molded according to that community's interest.
So where are the obstacles in that? Are there anybody, my impression before starting these interviews especially was that the police are into the war on drugs and filling up the prisons, and that's really all there is. So are the police coming along with that, or are there other obstacles? Is money part of the issue?
I mean, money, resources, sustainability, capacity, right? All those things, right, fit in, are there, right? It's interesting because unlike Weed and Seed, which was a federal program under the Clinton program that was like they provided all this federal money to like weed out problems in cities and places, and like then this program money to seed in programs, which are pretty much a money to like a ton of police overtime, a ton of like investigative equipment, a ton of like investigation time and meetings between like people in white shirts and brass, right? You know what I'm saying? Badges and other people with titles and officials and politicians. And then what we got was midnight basketball, right? In the community, right? We got midnight basketball. We got like a health fair. Maybe somebody got, an apartment in the projects, right? But like, what we're looking at like is what it is, right? We're looking at a program that's top down, So like the sustainability for this, like some places, the lead program we facilitate, like we run that program. The project manager works for Catal. He's a harm reductionist, right, for the last couple of decades, right? So
Right.
he's also like his name is Keith. I should say his name, right? His name is Keith Brown, right? But he's
Yeah.
one of the most respected harm reductionists in the country. And so he brings that to his, framing for the program and its expansion and its application. Other places don't necessarily have that. I don't think. I think there's a difference. And then there are other places that are lead-like programs that are maybe more heavily run by and directed by like the municipality and less as much by like the community. So there are a number of different ways of doing it. Is it sustainable? Yes. The most difficult thing about that type of work, right, is that it's just not sustainable if you don't. It's not sustainable if it's completely run by, and I mean by run by, I mean like driven by the municipality or the state.
Right.
It has to have like political viability, and it's got to meet people's needs.
Well, and having a community-based and community-organized program is so much more grounded and responsive, and yeah.
It's a lot more difficult. You pretty much double the resources because like you may have 8 case managers if you're lucky, right? You may have 2 if you're lucky.
Yeah.
And you got a project director, right? And say you've got some other folks, right? Admin staff, right?
Mhm.
When you add to that put the premium on community involvement and directly impacted leadership, when you add that to it, you're literally adding like 3 staff people, right? So that's the stuff where like that gets cut first, right? And then and eventually the program like kind of starts to fold into like this, right? We all know how that goes, right? And so
Right.
we don't see lead as like this like magic bullet. We don't even see lead really as the best answer, but it's this programmatic systemic shift, not necessarily change, but it's a shift in relationships that at the very minimum have allowed people to like extract from some of the broken windows, community policing theory and narrative, some of the more positive aspects of that, right? And so, right, we see these different relationships between people, right, where people aren't as vulnerable to like the system's, demands and expectations at the same time, right? That makes sense.
Yeah, it does. Well, and isolation and lack of social trust is such a big part of addiction.
Mm-hmm.
This kind of work that you're doing really addresses that directly.
Yeah.
Yeah.
What we're talking about right now, and part of the reason why I'm kind of like leaning into it, like this is the turning point in my career as an organizer, right? Being exposed to and having to come to like at that time you could imagine very early and superficial connections to like what happened to my family and like the state part, the systemic change needed, like when that stuff, like I'm still lining out those things up, right? And the dates even, right? What's really sobering, right? No pun intended,
Mm-hmm.
right? About this is there will not be an opportunity for the system to take us backwards, right? So none of this is happening in a vacuum. So people who we used to call crackheads, right?
Mm-hmm.
We are now, right, for those of them who survived, right? We're now calling them grandma and grandpa, right?
Mm-hmm.
We're calling them survivors now. So what we see here can we bolster and strengthen the relationships of the survivors by, right, helping them to learn to bring their experiences to the table. You're formerly incarcerated, you are active user, you're currently incarcerated, you're in recovery, right? Let's not argue. Let's make a demand based on what you think this community needs, what this city needs, what this state needs, right? What this program needs, right? What this department needs, right? And let's just for kicks, not give a damn what people think about us, right? Now, I know that's easy to say, that's easy to kind of whatever, right? But it's like, if there are enough of us who don't care what they think about us, we become the majority, right? So community organizers, to harm reductionists, to public health advocates, healthcare advocates, right? Like, if we actually meet people where they are, right?
Yeah.
And we don't do for them what they can do for themselves, right? The only question then is like, what the hell are you bringing with you to help, right?
Mm-hmm.
When you meet that person, when you meet that person where they are, when you meet that person, right? And y'all kind of figure out like what that person want to do, the question is only like, what did you bring with you to help that person like facilitate that, right? I feel like we're at that, we're always at that place somewhere, but I feel like we are specifically at that place around healthcare, criminal justice reform, public safety, right? And and public health, right? I feel like those things are like converging in on each other in a way that's forcing us to discuss like this in a different way. And harm reductionists, public health advocates, and community organizers are the only people with the specific training and wiring to have this conversation.
And it's all based on the direct experience of the people most affected.
We used to call it anecdotal. Oh, that's just anecdotal experience.
Oh, right.
That's just anecdotal experience. No, now we call it survival. We call it wisdom.
So there are some really good things happening.
And I mean, I focused on lead a lot, but I want to say that there are some amazing things happening, right? And these things are happening like off the beaten path. So I don't want to start getting into like calling the names of folks stuff, because you can imagine like, well, he didn't mention my thing, right? But like, you can imagine the range of like ideas in a space like this where those ideas are being welcomed, right? People are really committing
to that. Without the names, but give us a few examples of that.
Yeah, so you got the lead stuff, right? You've got this other things, right? We're inside the harm reduction world, right? Where harm reductionists are attending community organizing training, right? Learning community organizing tactics, but applying it in ways that like only Vocal has done in some cases. So you'd have like this distinction in the 90s, right? If you talk about public safety, like that NIMBY, not in my backyard stuff. So public safety meant that we didn't do drugs. So but we still had harm reduction, right? How did those things coexist? Well, they always kind of coexisted in the back room. Pastors were harm reductionists, right? Pastors were community organizers, deaconesses, right? Like ushers were in churches were these people. They were not mainstream. They couldn't be mainstream. Why? Because so much of the federal money, so much of the political access was connected to you don't touch drugs. That's changed dramatically. Okay. So now think about this. We have people who've done significant time, who have significant issues, who have any minimal time, any minimal issue as a result. Trauma. We started getting to trauma, right? And we started talking about the impact on these communities as a result of the last iteration of slavery.
Right.
Like the last iteration of Jim Crow. Okay? As a result, the trauma inside these communities, right? Inside cities, right? Is calling for municipal strategies. So people are developing programs in these very local, intimate ways, much like they did in the 90s, but not in secret anymore. So you get overdose, you get Black people. There's a team of folks from the Greater Hartford Harm Reduction Coalition right now. They got T-shirts and everything, right? Yeah. They're the ambassadors, right, to like harm reduction, and they just run around the state in a wide open, doing this stuff, this damn work, right, and loving it and being proud of it and being praised for it, and it's all over Facebook, and they completely control the narrative. They control. I remember 2004, right, when the harm reduction van, the needle exchange van in Bridgeport, Connecticut was being harassed by Bridgeport police, and the ACLU sued, right, the city of Bridgeport and won, and they still were harassing those people.
Right.
We had to go up and organize people, organize harm reductionists with public health people, with social workers, with case managers, with probation officers, with police officers. And we had to put together new relationships within these municipalities. Willimantic, Connecticut, right? Branded Heroin Town, right? It is everything that people say like suburban communities are now with opioid addiction and overdoses, right? They were saying that about poor white people and Puerto Ricans and Latinos in Willimantic, you know what I'm saying, 30 years ago. They wouldn't provide them services. They had to go to Norwich or wherever it was. They had to go to like a whole other town to get help for the same stuff that now they can get through the Affordable Care Act.
Right.
They didn't get through those 10 essential benefits. You know, I know they're messing with them, right? But like the difference now is that you can do harm reduction in public. You can do needle exchange, right, in public. So as a result, communities are being forced to embrace not so much the life-saving work of harm reduction, ultimately public health, ultimately improve public safety. Everybody's safer, right, with expanded harm reduction, right? That's why we harp on that. But what's happening is that these mom and pop shops, these mom and pop programs that used to be beholden to like these like community health centers or these major medical facilities now, right, have the political flexibility. They don't have the NIMBY over their back. So people aren't like going after them in the same way. Instead, people are negotiating with them, right, to bring this life-saving stuff into communities where they traditionally have been pushed out before, or at least ignored.
Right. So how did that happen? What's your sense of what the shift was with people that could happen?
You can call it mass incarceration. You can call it continued slavery, right? People who got 10, 15 years time, right? All those, we started with children. We got these babies having babies. Then we had grandparents raising grandchildren, right?
Right.
Right? Well, guess what? You call them former inmate, whatever. You call them FIP. No, you call them political prisoner, right? Well, all those people that we call political prisoners, which ultimately everybody who went to prison for the drug war is a political prisoner, in my opinion, right? But like we call them formerly incarcerated people, but really they are grandfathers, they are grandmothers,
right? So
back in when we were just kind of cracking the nut on this criminal justice reform, drug policy reform stuff in 2002, 2003, 2004. A report came out from John Jay College, written by Todd Clear and Dinah Rhodes, 2 reports. One was on social capital inside of communities.
Ah,
The need to build social capital in communities in order to prepare for what they were anticipating was like reentry. So,
ah,
right at that time, people were still passing mandatory minimums. People were like, whatever, yeah, let's redo the library, let's do some community gardens, maybe we'll do like a fathers group at our church. Like that's what they thought that was.
oh,
Well, what Dinah Rose and Todd Clear are actually saying is that when the massive wave of reentry comes as a result of all these like the demands being raised around changes to the ending the drug war, marijuana reform policy, stop and frisk in New York, all of that advocacy and organizing that forced policy and systemic change, like, and now throw the ACA on it and boom, they started closing prison facilities and kicking people out, remember? Kicking
right.
people out of those facilities, and the money wasn't there because we were in a great recession. So there was no money. Well, I'm kind of jumping around, but like this is like early 2002, 2003 when we read this reentry report. It's talking about what we are dealing with in 2008, except it fails to mention we're going to be in a great recession.
Right.
So
So
cities,
no money for programs.
no money for programs, and many of these folks who started coming home, when they went inside, they lived in places like Hartford, the city.
Mm-hmm.
Now those families, right, in many cases, had moved to suburban towns with even less resources,
right.
less of a social network, so safety net.
Yeah.
Right? You start this lean into like, okay, forget all this quality of life crime prevention through environmental design, like broken windows crap, right? What we need is these specialty courts. That's why Obama falls on the specialty courts, right? We need these specialty courts to up the services and programs that they're providing. It's the only thing we have in place to accommodate all these people who were getting their services inside of facilities.
Right.
Furthermore, they don't know how to navigate this system on the ground out here because they've been navigating it, even if they were in and out of prison revolving that, right? Even if they were that, right, they had the problem of like the door that we're revolving in and out of is not the same one they got to go through to deal with what they got to deal with now.
Right.
And they came home with health conditions like this got clouded up with like on the down low. Like, it's like, where are all these new HIV cases coming from with all these heterosexual, like Black and brown women? It must be all these, Oprah told us it was because Black men were on the down low in Atlanta, playing like cards or not playing cards, right?
Right.
In reality, it was like more, if we're just gonna like grab stuff out of the sky here, right? A more realistic explanation, as horrifying as it is that people didn't get tested as part of protocol going into prison facilities. I mean, they've been coming home, right? They'll get tested coming home. So, right, I think we talked about this a little bit before, right? Mm-hmm. You have like this mass like vacuuming up of Black and brown men, right, in the 80s and 90s, right, with the drug war. And then you get welfare reform where you get them kicked out of their homes, they go to jail. But people start coming home, right? Women too, right? Start coming home from these facilities 2002, 2004, 2005. By the time we hit 2008, we have like a major like flow of people across the country. President Obama, he does the sentencing, right? The restructuring of the sentencing guidelines of 18-1. Right? The numbers go up, people coming home. Well, these people are coming home having gotten tattoos. These people coming home having engaged in behavior, right, that may have exposed them, right, to HIV,
Right.
Hep C. So now we're hearing, oh, baby boomers, you all got Hep C, go get tested. Like, oh, great, now you tell us, right?
Right.
I tell you that's because of the Black, that's happened because Nixon threw a whole bunch of people in prison with the Black problem, dealing with the Black and the hippie problem in '69. So
Right.
like go from 69 to 2019, just for good measure, right? It's not until it's like everything that's happened between then and the ACA in 2010 has been about draining the safety net, dismantling the safety net. And municipalities dealt with that by, right, shoveling people into the criminal justice system, which then took them and hid them away in a corner, right, and turned prisons into mental health facilities, and then rewarded, right, the people inside the community, right, who then turned those people in. Sound familiar?
Wow. And that's an analysis of these large movements in history that affect millions of people.
So you have Black pastors preaching sermons about how Black men wasn't shit. They wouldn't take responsibility. They're deadbeats. Latino men, abusive, alcoholics, machismo. We gotta have a special protocol in California because like Latino men, Mexican men, they just don't like it when you challenge their authority. Slow down, Chico, like literally. And then when Trump comes and says we got some bad hombres, we go, how dare you say that? It's like that's exactly what we've been calling, you know what I'm saying, Latino men and women.
Right.
Right? Look at the Clintons' immigration policy. I think it was 95 or 96. Like, stop. I'll say this and I'll stop rambling. The most important thing I felt like has happened, to actually answer your question, right, has been like this demand of changing the narrative.
Mm-hmm.
Okay. When we decided to take this on in 1999, when we said no, right, we're going to organize folks, right, in the harm reduction community because they are people who are active drug users. They can speak to drug policy that gets changed. They can speak to the criminal justice system and the mandatory minimums that they've dealt with. Their families can speak to us. As organizers, it just makes sense you organize that base of people. Nobody else would talk to them about that. And the first thing we learned was, like, if you wanted the group to be successful, you had to put people in positions where they felt like they were being successful or would be successful. So we didn't ask formerly incarcerated Black men to go to the Capitol and advocate for criminal justice policy reform. We asked them, right, to write an article about what they think about the legislative proposal. And then we'll help you edit it.
Mm-hmm.
They're like, well, okay, we'll get you we'll get you a place in the local newspaper. So people said, okay, that makes sense. I'll write my ideas down. Like, give us like 3 paragraphs, and we're gonna put it in, we're gonna clean it up, get it structured up. You take a look at it, and we're gonna like see if we can get it moving. Okay, so we did that. We had 15 guys, right? It starts with Black and brown men, Black and Latino men. So how many y'all want to write? We got 4 of them. A couple of them like had been writers, were writers at the time, right? Like they had stuff ready to go. They didn't even need any work, right? It was better than what anybody would have given, right? Anybody would have edited pretty much that we could provide. Those things into it. We took them and one by one, every week we posted like one of their like writings in the local free newspaper. It was only for the purpose, right? To put them in a position where people changing the narrative, where people's narrative and story about them had to change and be consistent. So it's like, oh, last time I heard of Lorenzo, what he writing about? I ain't heard from Lorenzo since the last time he went to jail in 2016, right? That what people said. Faster. So eventually what happens is children, their children start cutting their article out the paper. Said, my father wrote this, my mother wrote this, my uncle wrote this. And they would go and read their father or their uncle or their mother's like, you know, article, like at school, at church, right? For the youth program, right? Mm-hmm. It was like, oh, can you all come in and tell us about what you wrote about, right? And so we had sessions where we had like just women of color sit down and talk about overdose in the Black community in 1999, well before we were talking about what they're talking about now. When we use, I'll stop there, but it's like the idea was to put people back in positions where people had to reckon with what the strength that that person brought to the table. Put you back in a position where if you're a strong writer, let's get you writing. If you're a strong speaker, let's get you talking. Let's get you reading, right? Let's do some leadership development that literally develops your leadership. And people say, I haven't felt like a leader since I was in Boy Scouts or since I was in elementary school when I was the hall monitor. Or people went back there. That's the trauma. We said, okay, we're gonna find you where you're at. Where are you, right?
Yeah.
Where you at? Okay, now we're gonna write an article about that. And people wrote, like, I was a hall monitor. And the last time I felt like I was important to my community, or I felt respected by my community, I was a hall monitor in 6th grade at Wish School. But the thing about it is people who went to Wish School, people who knew that person, people who knew that person got it and was like, oh, I know Lorenzo. It's really good to see him doing this, right?
Well, and it's a direct hit against the stigma and the shame.
And it cost us, what it cost us staff time, but it was a free newspaper. And of course, the paper, a ton of people who were not reading the paper started reading it. So now, when the legislative session started and these people in the group members were writing about like things that the governor was talking about, game on.
Yeah.
It's like the governor just gave her the thing. And it's like the chair of the brothers group is writing a response to the governor's state of address. He just got out of jail 6 months ago and was there for 14 years. He's writing, but he never stopped watching the State of the Union. He never stopped watching the state of the state address. He just never took the position to write about it and get it out there for people. And he's not an idiot because he was in jail for 6 months ago. It's the platform, and it helped people regardless of where they were in their recovery, in their trauma, in their development, in their educational prowess, in their personal situation. The idea was that we were meeting them where they were, and we were giving them opportunities, right, to flex that and to strengthen that skill set. And then stepping back and just not even do anything other than getting out of their way, because most people, like a bird, right? It's kind of build the strength up and boom.
Yeah, exactly. Yeah.
It was efficient for us because we were able to work with a bunch of people over a very long period of time. And, and people that we worked with eventually were taking that ideology, taking that theory of change, of meeting people where they were, not doing for them what they could do for themselves. And we're using that to bolster and build participation in their own groups and incorporating that in their own thing. We're still training people in that stuff today. I was just in Michigan, Alabama, North Carolina, New York, Connecticut. We're training everybody, in Georgia, in this idea. And we're finding a lot of success with harm reductionists and public health folks, because if you're doing healthcare and public health work, you're doing housing, education work, anything like that, you gotta meet. If you're doing it legit with people, you're meeting them where they are, and you're building your work around what they need, what they demand.
And it's all grounded in the wisdom of the community. Yeah.
We used to call that anecdotal experience.
Right. Well, to circle back to when we first started talking, you were talking about being trained as a community organizer in a mentorship kind of a program. So you learned as an apprentice from people who were experienced at community organizing.
Oh yeah. So the folks who trained me were ultimately trained by the folks who Walensky trained. So my primary mentor, Jack Memnaugh, my my other mentor, Alta Lash, right? Jack trained Alta, right, as an organizer. Jack came out of Providence. Jack was trained by Stan Holtz, right? And I forgot who trained Stan Holtz, right? But that person was trained by Walensky. So I was kind of and I only say that because I have a hard leaning towards direct action. a hard leaning towards like the organization building and like the relationship building and the power building. Black Lives Matter work, the harm reduction work, this work around trauma, this work around public health and public wellness, right? Help round out and actually bring some substance to, right, this like very hardcore, rigorous organizing, right, regiment that I was trained in. Oh, just lastly, like, and the last thing is that the organization that I started at wasn't your typical community-based organizing project, right? It was like, it wasn't like an ACORN, right? Or Center for Community Change, or even IAF. So like UCAN, the place I worked at, it was started to be a technical assistance group to community organizing projects. So right? So it's like we ran our own campaigns, we had our own base building projects, but then we also were responsible to like building the field of community organizing in Connecticut, especially. So like a lot of my history comes from, a lot of my training and development is based in the development of leaders and organizers, right? And I obviously have my own track record of running campaigns.
Right, right. So where could people learn more about those? What are some of the website addresses where they could learn more?
So for which ones? For UCAN or for like those organizations?
Well, whatever you think would be important for people to know. Certainly for Catal.
Yeah, so catalcenter.org. Our website's under construction right now, so it'll be up, and we're trying to get it up in a little bit. That's a great question. Vocal, 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 and then Vocal has chapters like vocalnewyork.org probably. They're a harm reductionist who have been using community organizing, right, tactics, right, for their work. Probably some of the most well known for it. The lead project at Albany. I want to say it's leadproject.org or albanylead.org, but Keith Brown is there. You can find his bio as on our staff on our site. Keith Brown. There's an article. There's a piece written by my co-founder and a couple of folks called "Healthcare, Not Handcuffs."
Oh, okay.
Right. And it's like almost like just for lack of a better description, a white paper on how to use the reforms to the healthcare system to shift the criminal justice system, right, to change that paradigm. So definitely that would be a good thing to read. And I haven't looked at this yet, but I've heard a lot of good stuff about it, and we haven't used it. We will though. The United Way has, I think I mentioned this when we talked before, the United Way has the program, the Alice Project, right? And it's more of like an exercise that's like around like poverty and like living off fixed income kind of stuff, right? And they're using it to train like the parents in their networks in New England pretty much. So let me back up a little bit. Another thing I would just suggest people read, and are we looking for books or just we're just looking for reference stuff? We're looking for videos, looking for organizations.
Whatever you think would be important for people to know.
People should read Rules for Radicals and Stir It Up. Rules for Radicals by Alinsky and Stir It Up, which is more of an article or essays. Definitely undoing racism training. Yeah, people should check out the Drug Policy Alliance, the Drug Policy Alliance's conference, and that drugpolicy.org, drugpolicyalliance.org website. You don't win because you're right, you win because you're strong. We get that from The Art of War, Sun Tzu, The Art of War. People would be like, well, we're right, so you can't, God's gonna help us, or righteousness is gonna help us prevail. And they'd be like, well, yeah, you stand right there. Oh, even better. The prime example of it is the Count of Monte Cristo, the remake of it, the latest one. right? When the warden walks in, it's like the guy's tied to the wall and he goes, "Hey, how's it going? I'm gonna beat you every year, right? Just on an anniversary, right?" Goes, "Well, I love God and God's gonna show up here. God's gonna," well, I tell you what, I'm gonna start beating you, and when God show up, we're gonna stop, right? Kind of thing, right? And it's like you don't win because you're right. You can have all the information, all the data. You can have all of the righteous, indignation and authority. You win because you're strong. You got to go build relationships. You have to go and do the things you need to hold accountable the system you're trying to hold accountable. And the only way you can do that is by being strong enough to force the system to recognize your expectations of it.
Yeah, I love that. Yeah.
Because you're strong.
So I think you've just answered this question, but maybe there's something more that you want to say about it. What would you suggest or recommend for people who are needing to get into recovery or in recovery and wanting more, or people who want to support that? What are a few things that you might tell people?
In a very practical sense, right? If you want to, you mean into recovery work or into programs?
Well, or into however people might define recovery. It might be that they're using drugs or alcohol or some other addiction. It might be that they want to get involved in recovery work in an organization.
Find the harm reduction network in your state. I tell everybody that, the absolute first place, in my opinion, other than yourself, obviously, right? If you're going to go outside of your network and try to talk to folks about this stuff, you cannot go wrong by talking to the harm reduction network. It's like if you talk to them at the very minimum, they'll tell you sound crazy, right? Understand, harm reductionists are wired. They're completely wired in a way they have no control over, right? And that is to meet people where they are. A harm reductionist is not going to bullshit you, you know what I'm saying, for the most part, right? To them, you're taking time from other people. If you're a harm reductionist is hey, there's other people out here that I could be helping. I don't got time to waste it with you. So they're very diligent, rigorous about that, right? So I would say start with, go find a harm reductionist, right? Google it. The second thing I would tell people, right, is about doing this work. If you're not trying to get into your own recovery, right, find some way and help put together some overdose packets. Right. Just go to the soup kitchen, go to the closest group wherever the nuns are. Nuns are great. Go find the nuns, right, and ask the nuns who's doing harm reduction, who's doing resettlement kind of stuff, around immigration, and you're going to probably find folks at that intersection.
I'm wondering if there's anything that we haven't covered that you'd like to finish with.
No, just that people closest to the problem, right, are closest to the solution, right? And we don't call it anecdotal data. We don't call it lived experience or life credits. We call it wisdom, because that's what it is, right? And we want people to share their wisdom with us, share it with each other, right? And then we're going to do what we can to change systems with it.
Right. Well, it's been really interesting, this discussion.
Thank you.
I'm very happy that you came on the summit and that you took the time out to do this. I've learned a lot, and I think it's a wonderful voice to have in the summit. There's so many different ways that people are working with this, and the historical perspective as well is really good to know, kind of the wider movements of history and how all of that comes down to a person's life in a community.
Yep.
How to work with that.
And the beauty of this is that we have that perspective already under our belts. Right. So it's we actually can operate with the wisdom that we've learned, right, that we've gathered, right? And it's people coming, we have this convergence of people coming home with wisdom, right? People who have been home with wisdom, people who never went in, but have been the folks, you really want to know how to fix the veteran system, the VA, right? Don't talk to the veterans, right? They're the people in it. They're caught up in the machine. Talk to the caregivers. Talk to the caregivers of formerly incarcerated people, the caregivers of people who are using drugs, right? The caregivers of people who are like dealing with like the holes in the safety net.
Right.
Those are the people who know what needs to be fixed in the system because they're the ones who sit on hold and go to the appointments and take vacation days from work because they might have multiple people in their family with these situations. We can organize those folks and include them in like the problem solving and like, you know what I'm saying? Like, man, it's like man, we could do something. Harm reductionists know how to do that. They don't know how to organize to save their life. They don't know shit else, but they
Yeah.
know how to meet people where they are and they give a damn about people, right? And it's like, we can teach them the rest. They can teach us the rest.
Go to killibycenter.com, Radical Recovery Summit, to see the full schedule of speakers and to register to watch these free online September 23rd and 24th in the Radical Recovery Summit 2017.